They just recently published a meta-analysis, and it was over 12,000 patients. And they found it did seem to work for acute pain, including post-surgical or in the emergency department, and chronic pain for low back pain and shoulder surgery and all kinds of chronic pain issues.
Welcome to the Learn Skin podcast with me, Dr. Raja.
And me, Dr. Hadar, where we discuss all things skin.
Join us as we delve into the art and science of skin health in today's episode.
Hey, Raja, can you say the thing I told you to tell them?
Of course. We are board-certified dermatologists. This podcast is meant for educational and informational purposes only and is not considered medical advice, nor does it serve as a substitute for professional care by a doctor or other qualified medical professional. All opinions shared do not express the views of Learn Health, Inc. Let's get to the good stuff.
Hey, Raja, how are you today?
Hey, Hadar, are you feeling a little bit of a needle?
I don't know about needle. I do feel pain, and I feel the pain of my patients. You know, we do a lot of procedures in clinic that cause pain, little biopsies, debridements, all kinds of procedures. You know what I'm talking about. And there's a need for pain management that is not necessarily pharmacological, if you know what I mean. And I'm wondering if we can come up with some ideas, maybe bring an expert that can help us, maybe yank us by the ear, if you know what I mean.
That's exactly what we're going to have done to us today. Proverbially speaking, it's Dr. Steve Daveluy, and he's an associate professor and residency program director at Wayne State University in the Department of Dermatology. And he also holds a special interest in complex medical dermatology, such as HS, and he works in skin of color, teledermatology, but he also has a special interest in integrative approaches to skincare and integrative dermatology. So that's why we've got you here, Steve. You're going to talk to us about battlefield acupuncture. We're really interested.
Oh, thank you so much for having me. I kind of want to let my inner fanboy out and say longtime listener, first time caller, and really nerd out. But it's
absolutely
an honor to be here and a pleasure for me.
And I remember Dr. Daveluy, who is now a good friend and a colleague who, if I may add, Raja, to his impressive CV, that he's also part of the HS Foundation and really an amazing advocate for his patients and patients nationwide. So really, thank you for doing that. Kudos. Amazing work behind the scenes. Nobody would ever know, but he's pushing for the patients like nobody has ever seen. And I remember Steve, in one of the first Integrative Dermatology Symposium, sitting in the front row, taking notes, asking questions, being so engaged. I'm a big admirer of your passion about everything that you do. Thank you.
Can I just say, we need people that are actively engaged like you, Steve, in the front row, because it motivates the lecturers like no other.
Absolutely.
I really try to pay attention to those sorts of things. So I met Steve at the Integrative Dermatology Symposium, and maybe I'll meet one of you all that's listening at the next Integrative Dermatology Symposium, October 22nd to the 24th. But let's get to battlefield acupuncture. I think that'd be great.
Yes, absolutely. Because it's funny right now, because you're going to be a speaker now. You're going to have your own workshop at the IDS, and it just shows our community is growing, people getting expertise. And, it's just so much fun to see these new leaders rising. It's just a fun experience for me as well.
I got to ask, battlefield acupuncture. It sounds like something you'd use in a war zone. Can you give us a background to what is it? What's the history behind it?
Considering all the dermatologists in the battlefield.
Right. Yes, I'm happy to fill you in. So it sort of is related to the military. It was pioneered in 2001 by Richard Nimzow, who was a colonel in the Air Force and a medical doctor. And he sort of looked at this auricular acupuncture, which is kind of the broader ear acupuncture, where they have these maps and there's spots all over your ear that correspond to different parts of the body for giving treatments through doing acupuncture on the ear. So he tried to sort of whittle it down into a very practical one that he called battlefield acupuncture. And it's just for pain. So he studied the auricular acupuncture and said, all right, these 5 spots all correspond to pain. Let's see if we can put needles in these 5 spots and help people with their pain. And part of the reason he called it battlefield is because it could be used on the battlefield or in deployment, because it has a couple advantages. One is you help someone's pain, but there's no sedation. So if you were in sort of a high risk situation, you could do it to someone and they wouldn't be drowsy. They'd still be able to sort of walk away with you or still have their wits about them to sort of get out of a dangerous situation. And then because it uses the ears, you can do it when someone's fully dressed. So that's kind of a quick and easy thing that you can do on someone. So it's like the perfect setting and the perfect fit that he just came up with it. And when he first used it, it wasn't actual combat applications. It was just seeing people in the clinics, like Hadar was saying, pre-procedure, post-procedure. And that's what most of the studies have been on too, although the military has adopted it and the Veterans Hospital system has really taken it up.
Well, Steve, now, this is just fascinating. Not only is it genius, but oh my gosh, you really have to attune into the systems of the body to understand this. Now, what is the mechanism behind this? Is this playing on the meridians that comes out of traditional Chinese medicine? What is it about the auricular area that makes it so attuned to treating pain?
Good question. First, let me preface with saying I am not an acupuncturist. I am only certified in this specific battlefield acupuncture. And it didn't take long to get certified. It was just a one-day course that I took through our Veterans Hospital. But it's kind of neat because when preparing the course, they mostly are presenting it to physicians at the Veterans Affairs System. So they did kind of review some of the information with us. And then, of course, I went out and looked up some more myself. So it does relate to the meridians that we talk about with traditional Chinese medicine acupuncture. And almost all of the meridians are connected to the ear, or they're sort of one step off from being connected. So one connected to a meridian that connects to the ear. And then it's sort of interesting. There's been some studies looking more from a traditional medicine perspective, and they found that the auricular branch of the vagus nerve innervates your conchal bowl. And because it communicates with the vagus nerve, it relates to your respiratory rate, your heart rate, your GI function, and to your actual brain. And so they've done some studies where they found that all of these spots that relate to pain hit the auricular branch of the vagus nerve. So they're sort of sending these signals back. So we sort of know that, somehow way back centuries ago in China, they figured out these meridians. And what do you know? It actually corresponds to some of our nerve connections. And they think that may be how it's working is by stimulating the vagus nerve and changing the tone of the vagus nerve.
So, Steve, I wanted to ask you because I do know that it actually does work. It's not just something that you do and maybe there's a placebo element here. A good friend and colleague, Dan Fetterman, who's out at Yale, who's an internal medicine doc, taught me what I know about this and its use in wound healing. So people who have a wound-related pain, veterans, have been receiving this treatment. And he's done some work showing that it can definitely decrease the amount of pain. But I want to put this in perspective, right? So it's not like it's going to take a pain of 10 and reduce it to 0, just like a snap of a finger, right?
Right, exactly. In most of the studies, the pain reduction on the 10-point scale was around 2.5 points. But for a lot of people, that meant getting off one of their prescription medications.
Exactly.
Yes, which is huge. Like, for example, I did my training at the Detroit Veterans Affairs Hospital. And they really started pushing for this because the VA has this extra challenge of a lot of people have injuries and chronic problems, chronic injuries that give a lot of chronic pain. So their opioid prescribing levels were even higher than the national average during the opioid epidemic. So they really poured some resources into, all right, we need a pain treatment that is not an opioid. And so at our Detroit VA, once they started doing this training, and that's how I ended up getting trainings because they were pushing it to everybody. They said, everybody, come and get this training. And I said, well, I'm a dermatologist. Can I still use it? They said, sure. You deal with people who have pain, right? I said, yeah. So at our VA between 2015 and 2019, they saw a 77% reduction in the emergency department injectable opioid use.
Wow.
So like you said, there's numbers.
That's definitely huge. Now, I see that we're talking about acute pain when I think of acute pain if it's battlefield, but then we're also talking about chronic pain. Do you find that it's equivalently efficacious in both scenarios, or are there studies around that? How do you use it in the clinic? Maybe that's a loaded question because maybe you use it for certain diagnoses, but I'm curious. The first question is, chronic versus acute pain, and then if you can kind of dovetail on that to tell me how you use it in the clinic.
Absolutely. So in the studies that have happened already, they've looked at both chronic and acute pain, and they just recently published a meta-analysis, and it was over 12,000 patients. And they found it did seem to work for acute pain, including post-surgical or in the emergency department, and chronic pain for low back pain and shoulder surgery and all kinds of chronic pain issues. And it does seem to work well for both. How I've started to use it, and it's interesting. In our clinic, we do some clinical research, and I'm actually trying to look at some of the uses of it in dermatology. So the first study that we started, and it's still ongoing, and we're recruiting people who are willing to participate, is looking at the chronic pain that comes with hidradenitis suppurativa. Because of all the skin conditions, pain is a major issue for that. That and pyoderma gangrenosum are like the things that I think, oh, those are my derm painful patients. They're the ones who are really suffering with pain. So I don't have the results yet because the trial's ongoing, but it does seem like we're seeing favorable results in people with HS to help deal with their chronic pain and bring it down to a more manageable level. I've used it in some of my HS patients too, because, nowadays, I hate putting anybody on an opioid. We try to keep it to the minimum that we need it. We try any other therapy. And most of the time I end up sending people to a pain specialist, which is a great resource to have and someone who can be really helpful. But like Hadar said earlier, we're trying to really get away from medications that especially have addictive potential, but even other medications like gabapentin, it can be great for pain, but there's side effects with sedation and other issues, and not everybody tolerates it well. And with the battlefield acupuncture, the adverse event rate is super low. It's like 0.6% when they looked at the meta-analysis. And the kind of adverse events we're talking about are a little bit of pain when the needles are being inserted. Some people had a little dizziness and lightheadedness just temporarily, or even nausea. And then one of the interesting side effects is actually some people get an immediate sense of euphoria right after they have the needles inserted.
Is that a side effect, or is that like a amazing effect?
Right? Sign me up.
Buy one, get one free kind of deal. I want to maybe ask you about the technical kind of nitty-gritty of this. So can you tell us how this is working? So does the doctor have to do it in clinic? Does the patient do it by themselves? How many times a day? How complex it is for the patient? How much is the cost of this? Those kind of nitty-gritty that really make the big difference.
Absolutely. So the doctor or healthcare provider does it in the clinic. So for example, like at our Veterans Affairs, there's nurses who do it. Just about everybody in the pain clinic is trained how to do it. And it's 5 little spots on an ear. You can either do one or both ears. So a lot of the early studies were both ears, but now they've sort of recognized that it seems like one ear kind of works, and then you can alternate with each treatment. We usually treat people once a week, or some people it lasts longer, so they don't need it quite as much. So it's a little variable how long the pain lasts. A lot of the studies, it lasted at least 7 days. So that's what we usually do, and it's not too inconvenient. And you sort of do 5 spots in one ear. There are these, we call it a needle, but it's kind of interesting. It's this little tiny gold, almost like a dart, and there's a little plastic applicator. So it's a little bit painful because you have to kind of push that in and get it to stay. Then the needles actually stay in the ear. So they fall out after about 3 to 5 days. A lot of times we'll put these little, they almost look like a little Band-Aid, a little tiny bandage over top of them, just because it helps to prevent trauma from gripping them. I know when we practiced on each other, so I've had them in before, and you just absentmindedly go, oh, what's up there? And all of a sudden, next thing you know, you're pulling on one of them or scratching one of them without thinking about it. So then what we'll do, like a lot of the chronic pain patients at the VA clinic will come weekly and they'll get one ear and then the other ear. And like I said, it's variable. Some people don't need it that often. Some people prefer both ears. They feel like both works better for them and they get it done every time in both ears. But for most people, it's just kind of one ear and then repeat on the other side and keep doing it as much as you need. It's interesting you brought up the home idea, because I've actually been sort of kicking around this idea of would it be possible to train a caregiver? Because I don't think you can really do it on yourself very well, because to see your ear to the point where you can actually pick and find the spots where the needles need to go would be a little bit of a challenge. But I don't think it would be that hard to train a layperson how to do this on their loved one. It's certainly at least as easy as giving an insulin shot to your loved one.
I think that makes a lot of sense. And, I feel like dealing with pain is such an important topic. And I want to give a shout out to the VA, because they do get a lot of criticism. And I think we as providers who work, I used to work full time at the VA, and I don't now, but I know other people, And every now and then they get it right. And I think they seem to have gotten it right on this thing, thinking a bit ahead of the curve and adopting this, what would people think more kind of an integrative, maybe kind of out there approach to do that. I wanted to follow up with you on the acute pain question. Are you using that in clinic, let's say before procedure?
It's almost like I planted that question because it's
You're
perfect.
welcome.
Our next trial that we're just getting the IRB approval for is to work with our Mohs surgeon and do battlefield acupuncture in the morning before they have their Mohs surgery. And we want to do it before they get anything, before they even have the lidocaine injected for numbing, to really see if that sort of like takes the edge off, helps people relax a little more, just brings the pain down. Even though Mohs surgery isn't known to be an incredibly painful procedure, there are some painful moments throughout the day, and then you go home and you might have some pain afterward. So that's kind of our next trial, is to see, all right, let's see if this helps reduce your pain. And I've used it personally on a few patients who warned me that, I'm very hard to numb up. They tend to need a lot of numbing on me. I'm really nervous. I say, well, would you mind? I do this acupuncture. I'll do it real quick. We'll give you a few minutes. I'll come back and then we'll do the procedure. So I think it helps them in a number of ways, because when we talk about pain, we talk about the actual pain and then the anxiety and the anticipation. So I think it's nice because we get through the acupuncture and then I give them a few minutes to kind of relax, calm down, let it do its thing. That also gives them a little time to kind of feel better and not worry so much. And it seems to be good. In those patients, I haven't really, I should ask them for pain scores just to see how it was, but I've gotten positive feedback. I haven't had anybody who regretted it. At the very least, some people said, well, I don't really know if it did anything, but I've never had this procedure without it, so I don't really know either way. And the supplies are really cheap. So I've been talking to our billing team about, can I start billing? There are CPT codes for acupuncture. I just don't know if the insurances are going to pay for it. And I don't know if they're going to pay me for it because I'm not an acupuncturist. But the supplies are somewhere between like $3 and $5. So just to help and benefit patients, I don't mind taking a little loss sometimes to say, all right, this is, I'm going to lose $5 in 2 minutes of time to help you be a little bit more comfortable. That's well worth it for me.
Hey, you know what? You were talking about euphoria. I'm getting euphoria hearing about the studies that you're doing. I'm getting euphoria just listening about this stuff. This is amazing. It's like a Kmart blue light special, guys. So, that's for you, Hadar. I love the fact that, Steve, you are doing studies on this stuff. I mean, this is exactly what we need to do in the integrative space. So I want to just take a moment to just say thank you for doing that, because now we can actually put some evidence to probably a traditional technique that's been used for many, many, many years, I'm sure. It's the auricular space is not something new. Even in Ayurveda, they're known as marma points on the ear. And, children self-soothe when they're drinking out of a bottle by touching their ears. Fun fact, I still have that habit, actually. I think it was a carryover from when I used to drink the bottle. I guess some childhood habits die hard.
Yeah, and that actually brings up a great point. Do you know of any studies or any information on battlefield done in children?
That is interesting. I can't say I've come across any studies that did it in children yet. It's a little tricky because I mentioned that meta-analysis. They had 12 studies in there and 10 of them were done at veterans hospitals, because that's where, like you said, they've really taken up the mantle, and they invested some money in training people across the country. So there's at least 57 VA hospitals that do it. So a lot of the studies have been skewed a little bit because obviously there's no kids in the Veterans Administration hospitals, fortunately. But yeah, that would be interesting to see in kids. And I know people do acupuncture in kids. You always worry that, they might be afraid. But honestly, even if you showed them the tool that helps, the little applicator that helps you get the needle in, it doesn't look like a needle at all. It actually looks like a little clear plastic bottle that Barbie would hold. So it's just this little tiny plastic thing with this little gold tip at the end. So even that would be sort of helpful in the sense that, they wouldn't get that needle phobia. It is a little bit uncomfortable just as you're putting them in, but I wonder if you threw a little bit of a topical numbing agent on a kid's ear, if then you couldn't do it and they would barely notice, or, use some of our typical distraction techniques. So now you've inspired me to do another study and see how it goes with kids, because this could be really helpful for a lot of the things we have. Nobody likes doing a procedure that hurts on a kid. You always feel terrible and they get so upset. And
Yeah, that's certainly a huge gap right now in our ability to help kids, because you mentioned veterans as a particularly vulnerable population to maybe drug abuse problem and a lot of opioids intake. But kids, we often forget that every little procedure is very traumatic to the child, so much so that some physicians don't feel even comfortable doing these kind of procedures, and they kind of think twice. And so we've done some work with virtual reality on this, and we definitely used it in some kids who really love it. And for them, the technology really, they're doing much better than the 60-year-old with that. And so they totally dive into the virtual reality world and enjoy that. There, the mechanism is by distraction, we think, and some evidence suggests that it's true. And so I think there's a huge need for that. I wonder how kids will react to the initial poking, but that's a different story. So here, look at that. We went around, we got buy one, get one free. We went from pain management all the way to Barbie's drinking issues. We definitely covered the span of it. Now, for those of you listening out there, you're saying, all right, I'm totally hooked. I want to try this. Well, I have great news for you. So Dr. Steve Daveluy is going to actually hold a workshop in the coming Integrative Dermatology Symposium. As Raja mentioned, this is coming up in October. In it, he's not going to certify anybody, but he's going to show you how it's actually done and give you a sense of, okay, you can do this. So if you want to be empowered to do it, you want to learn how this thing works, maybe play with this a little bit, touch it with your hands. Maybe even Dr. Daveluy will give you some euphoria doing it. So come join the workshop that is going to be held at the Integrative Dermatology Symposium. Hey, Steve, always awesome to have you here. I definitely see more and more podcasts coming. And thank you so much for your time, for your expertise. And I'm looking forward to that workshop.
Yes, thank you so much for having me. We'll see you in Sacramento.
Hey, anytime we can weave in a blue light special, we can weave in a little bit of euphoria, and we're talking about needles, that's a win.
Absolutely.
Hey, Raja, what are you doing this October 22nd through the 24th?
There's only one right answer to that question: the 4th Annual Integrative Dermatology Symposium.
Of course. Now, a question. Are you going to travel all the way to Sacramento, California to meet me in person, or are you going to join virtually in your pajamas?
Pajamas in person? Well, you might see me in pajamas at the Sheraton Grand in person in Sacramento, or maybe I'll be in a Jolly Folly costume. Who knows? But I'm excited to chair this hybrid one-of-a-kind conference with you, Hadar.
Well, man, I do love this unique event our team just put together. This is an event that really takes an integrative approach to common patient questions, also an integrative approach to challenging dermatology diseases. We also are going to cover aesthetics and have practical takeaways to start using in the clinic right away, just when you come back. So, this is the kind of information I just can't find with any other meeting.
So true. And the good news is it's not just for us. It's for practitioners of all backgrounds, and everyone is welcome. Use our discount code IDS25 at checkout for 25% off registration. And you can find us at www.integrativedermatologysymposium.com. Come say hi and tag us on social if you'll be there. And our tag is @Integrative Derm Symposium.
We hope to see you there.